I'm Dr. Rena, a urologist and pelvic surgeon, and welcome back to my channel. Today we're discussing whether medications like tadalafil or similar drugs can be used simply to add a little more excitement in the bedroom, and whether doing so is actually safe. These medications were originally developed to treat erectile dysfunction. If you're new here, you may know that I often highlight the advantages of taking daily tadalafil for several conditions, including erectile dysfunction. But what if someone takes a higher dose of these medications, even though they don't have ED? This practice has actually become quite common, which is why today I'm answering an important question. Is it really safe? First, let's talk briefly about how these medications work. Phosphodiesterase 5 inhibitors, often called PDE5 inhibitors, target an enzyme found in the smooth muscle cells of the penis. When this enzyme is active, it breaks down an important compound called cGMP. This compound is responsible for relaxing those smooth muscle cells so that blood can flow into the penis, creating an erection. When PDE5 is present and active, it breaks down cGMP, meaning the muscles can't stay relaxed. Instead, they tighten, blood leaves the penis, and the erection fades. Medications such as sildenafil, tadalafil, vardenafil, and evanafil work by blocking that PDE5 enzyme. By doing this, they stop the breakdown of cGMP, allowing it to build up and increase blood flow, which improves erectile function. That sounds impressive, and it truly is. For men who struggle with erectile dysfunction, these medications can be a real game changer. But what happens if someone who is otherwise healthy and doesn't have ED decides to use them anyway? And how common is that? In 2021, researchers published a review that analyzed 22 studies exploring the recreational use of PDE5 inhibitors across several populations. This issue has actually been discussed for many years. The earliest study on the topic appeared back in the year 2000, only 2 years after sildenafil first entered the market. Across those studies, which included about 25,000 men from different countries, researchers found that many men reported using these medications recreationally, even though they did not have erectile dysfunction. The reported rates ranged anywhere from 4% to as high as 66%. Recreational use appeared to be more common among certain groups, including men who were HIV positive, those who used other illicit substances, or those who engaged in unprotected sexual activity. The reasons participants gave were fairly predictable. Many said they wanted firmer, longer-lasting erections. Others hoped to improve sexual performance or increase how often they could have sex, including delaying ejaculation. Some admitted they simply tried the medication out of curiosity. Many also reported combining these drugs with alcohol, cannabis, or other recreational substances. And interestingly, most did not receive the medication from their own doctor. Instead, they often got it from friends, without a prescription, or through online sources. So the big question remains, does that make it dangerous? If you've watched this channel before, you know I've talked about PDE5 inhibitors several times. Overall, I continue to say that these medications are very safe and effective when used for erectile dysfunction. They work extremely well to help men achieve erections that allow them to have satisfying sexual activity, and in most cases they are well tolerated, with only a small number of side effects. But what happens if you're a healthy person without erectile dysfunction, and you decide to use these medications just for recreational purposes? A few concerns can arise, and in some situations they could potentially become risky. There have been a handful of case reports in medical literature describing unusual events, but the main problems usually involve combining these medications with other substances. In some cases, men take them alongside things like cannabis, opioids, or even drugs associated with what's sometimes called chemsex. When that happens, the body can respond more strongly than expected. Let's start with cannabis. Cannabis can actually slow down the metabolism of these medications. In simple terms, that means the drug stays in your system longer and breaks down more slowly than it normally would. When this happens, the body may be exposed to higher levels of the medication than the dose was originally meant to produce. In general, when someone takes an appropriate dose that's prescribed specifically for them, the chance of experiencing a serious or permanent side effect is extremely low. However, once people begin taking higher and higher doses, we can't always predict the outcome. One potential concern is a condition called priapism, which is an erection that lasts longer than 4 hours. Some people might laugh and say that sounds like a good problem to have, but in reality, it's actually a medical emergency. After about 4 hours, blood is no longer circulating normally through the penis. Without fresh blood flow, the tissues stop receiving oxygen, and that lack of oxygen can cause damage. That's why anyone experiencing this needs to seek immediate medical care. Next, let's talk about something I mentioned earlier, chemsex. This term generally refers to situations where people combine PDE5 inhibitors with certain club drugs at the same time. Substances like GHB or methadone are sometimes used with the intention of enhancing sexual experiences. In many cases, people under the influence of these drugs may have sex for very long periods because their judgment is altered, and the medications are helping them maintain erections. When that happens, physical injuries can occur simply from the extended activity. For example, during anal sex, there can be rectal trauma. With penetrative sex, men can develop penile cuts or injuries, and partners may experience vaginal tears. This isn't typical activity for the body because of the length of time involved and the amount of friction that occurs. Of course, no one wants to end up in the emergency room after using illicit drugs and then injuring their genitals. Another concern is that when someone's judgment is impaired, they're less likely to make safe choices. That can increase the risk of sexually transmitted infections, especially if unprotected sex is involved and condoms are not being used. This risk can exist with or without PDE5 inhibitors, but certain substances can make it harder to achieve an erection on their own. In those situations, PDE5 inhibitors may be used to counteract that effect. These medications may make it easier to achieve an erection, which can lead someone to have more sex than they normally would while under the influence, increasing the overall risk. In fact, some studies have shown that recreational use of PDE5 inhibitors is associated with higher rates of unprotected sex and a greater likelihood of sexually transmitted infections. While these studies are not extremely large and may not represent everyone, the findings are still something to take seriously. Another possible concern involves visual disturbances. PDE5 inhibitors can also affect a related enzyme called PDE6, which is located in the retina of the eye. When this happens, some people may notice temporary changes in their vision. Fortunately, research has not shown permanent toxic damage to the retinal tissue or the photoreceptors when these medications are taken at appropriate therapeutic doses. The concern arises when people exceed those recommended amounts, because higher doses may increase the chance of unintended effects. There have also been rare reports of a condition known as non-arteritic anterior ischemic optic neuropathy. This condition can lead to permanent vision loss and has occasionally been associated with the use of PDE5 inhibitors, particularly at higher doses. Now let's talk about heart-related risks. One of the most important contraindications for these medications is using them together with nitrates. For example, some people are prescribed nitroglycerin to place under the tongue when they experience chest pain. If someone takes nitroglycerin and a PDE5 inhibitor at the same time, it can cause severe hypotension, which means a dangerous drop in blood pressure. In extreme cases, this can even become life-threatening. When medications are taken without guidance from a doctor, no one is reviewing your current prescriptions to ensure that the combination is safe. Fortunately, this situation is not common, but if someone mixes these medications with nitrates, or even with recreational drugs that may contain nitrate-like substances, the consequences can be very serious. Medical literature also contains a few isolated case reports describing unusual complications that happened to 1 or 2 individuals. Because these cases are so rare, it's difficult to determine whether they were truly caused by PDE5 inhibitors or simply coincidental. In general, when someone takes a dose that is appropriate for them and avoids excessive amounts, these medications are considered very safe. However, it's important to understand that they may not deliver all the effects some people expect. They might not delay ejaculation, they might not allow someone to have multiple rounds of sex, and they could interact with other substances, especially if someone is under the influence. Overall, if someone uses them to achieve a stronger or firmer erection, they will likely notice that effect. But if your erections are already functioning normally and you are otherwise healthy, taking a medication may not significantly improve things beyond what your body already does naturally. If you're experiencing difficulties with sexual function, the best step is to speak with your doctor. Many people who use these drugs recreationally may actually have had a previous episode where they struggled to get an erection, or they may have an underlying issue they haven't addressed. Sometimes they simply want reassurance that they'll be able to perform in a high-pressure situation or with a new partner. In those cases, discussing it with a healthcare professional is completely reasonable. There's also a theory that if someone relies on these medications every time they have sex, they could develop a psychological dependence. In other words, they might start believing they always need the medication to achieve an erection. Personally, I think that once someone has experienced a few successful erections, they can often return to natural erections because their confidence improves. Many cases of erectile difficulties have a psychological component, and rebuilding confidence can make a big difference. Do I think it's harmful to use these medications if you're experiencing erectile problems? Not at all. Do I think taking a low daily dose is dangerous? Generally, no. But taking very high doses or using them while you're not fully present, such as when you're under the influence of other substances, can potentially lead to serious consequences. And as always, remember to take care of yourself, because you truly deserve it.